Hi, everybody. I'm Dr. Christopher Barker, and I am a New Jersey licensed clinical psychologist, and welcome to Holding Space. Today, we're holding space with Renee McDonald, who is out of Australia. It's 11 o'clock at night down there. Thank you for joining us in your evening. I remember writing to you originally and inviting you to be on the podcast because I was intrigued by what you were writing on LinkedIn. And
Mm.
I've seen a number of good posts from yours recently. And I don't know. I guess in general, just kind of tell us all about yourself and what your interests are, what you're doing.
Yeah. Okay. Thank you for having me on, Dr. Barker. I am a licensed clinical psychotherapist rather than psychologist and a licensed clinical counselor as well here in Australia. And I'm also an ICF accredited coach as well. So I hold a number of different hats, I guess you could say. And I'm a mom and I'm like a wife and I've got all these different things going on. I guess you could say I'm have to have a swivel head these days.
Hmm.
So I've almost got a bit of a 360-degree viewpoint on lots of different issues around the place. Yeah.
I know we were talking about the thing that originally got me interested was you did one about the unseen work that therapists have to do.
Mm,
And
yeah.
I've seen you've also posted about AI and a few other things too.
Yeah.
What's what's holding your interest these days in that swiveling head?
Yeah, good question. Sometimes family, sometimes how family has traversed around the last kind of 6 years in the world. There's a lot of blowback even within my family about that. That's a whole other conversation. It's probably one for my own therapy, but that's a whole, thing. Then there's also, I have a lot of clinical interests now. I have clinical interests, particularly in the medical abuse space, and I have clinical interests in what happens when medicine goes bad. But then, how do we come back from that brink? And then also, what AI is doing to good clinical practice and why aren't good clinicians talking about that? Because I also know the other side of badly kept medical records. So that's again a whole other conversation. So I know that personally and also professionally and how much. So I was put through the ringer with a court case professionally a few years ago related to records. So I can even speak so I have a lot to say around how we keep records. And then because of all that, I've designed my own platform because of it all. So I guess that's why I'm talking about having a swivel head. Yeah.
Yeah, no, that is a lot. I mean, and that's all very interesting. The effect that AI is having on therapy is definitely something that I've been talking about for a while also.
Mm.
Maybe you can tell us a little more in your perspective on that.
Yeah.
People are tired of hearing from me.
Yeah. Yeah, sure. Thank you. So I guess um it's like almost like a big behemoth now. We're sharing a lot of information into it. A lot of us are, a lot of us aren't. Like I'm talking humans in general.
Mhm.
And a lot of AI is being used for like marketing or, some types of clinical practice or like even for bookings or, other things. So it's kind of good in a way where it can, in the marketplace, it can remove the friction from practice and help clients find you and things like that. So I can speak to that too, because, dabbling in that. However, because I've been working online for about 15 years now, and I have been training clinicians to work online for over 10 years now, I think I've got a unique viewpoint about the online and digital health space in that regards.
Hmm. I get something almost every day offering a virtual assistant or virtual bookings and that
Mm,
sort of thing. I'm still an old-fashioned person who has an office staff, and
mm,
we do it that way. But I don't know. It's maybe I'm old, but I don't really trust it completely for handling
mm,
all that.
yeah.
I had somebody write to me recently about something that I had said in a therapy session and they had misunderstood what I was talking about. And so they went and asked ChatGPT about it, and it gave her a totally different perspective on it and a totally skewed perspective on it. And
Mm,
the way people are augmenting therapy, I think, with AIs is, or sometimes using it instead of therapy,
mm,
is something
mm.
that's been kind of a pet peeve of mine. But
Yeah, yeah.
I mean, I can see the pros and the cons of it. Certainly,
Mm,
it helped me organize some of the things for a workbook I recently put together. And
mm,
so, without that, I would have had a harder time. But
mm, mm.
so that's, I guess, one of the pros. As far as
Yeah,
the cons go.
yeah,
Yeah.
yeah. I've been using it to put together things myself in a similar kind of manner. However, I think we have to drive it rather than it drive us. We have to, this is kind of this is a saying I came up with because I wrote a textbook about online therapy in across 2018, 2019. And there's a saying that I've got is we trade our clients' privacy for the clinician's convenience.
Mm. Say more
And
about that.
yeah, yeah, yeah. So it's both simple and profound if you think about it. So if we're just going with convenience, like get our phones out, sort it out, do this, boom, 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 that's all good and well. But do we actually know what kind of safety measures are in the technology? Do we know if they have HIPAA compliance or, in America and in Australia, it's, privacy compliance, you know, Britain and Europe, it's GDPR. Like across the world, there's different levels of privacy compliance and, healthcare compliance in general. And so are we actually adhering to what's actually professionally required of us? And it seems that everybody's jumped in and not even thought about that. And that kind of astounds me because going back to what I was talking about initially, what you were talking about, what my interest piece is, it's like medical records, privacy, all this kind of stuff. So how much are we handing over of our own data and who actually knows and who can access it? Do we know about that? Who are the people that read this stuff? Like, does it just go to this general cloud base? Is there some kind of big brother going through all of our stuff that we put in AI? Does anyone know? Can we ask anyone about that? Is it going to be handed over to the government? Like, I'm talking big brother kind of stuff. Does anyone even think like this? Like, this is not even paranoia speaking. It's where is it going? Yeah.
True. That's particularly true when you look at AI note taking and
Mm.
recording. And
Yeah.
there are some platforms that basically you can just dictate things into it and it
Yeah.
sort of does a summary and that sort of thing. And you're right. Where does it go at that
Yeah.
point? It's like all
Yeah.
this becomes part of a general knowledge base
Yeah.
because, I mean, technically, most of the big AI platforms take
Yeah.
things from all over the internet, but they also take anything that's being fed to them.
Yep.
So who
Yep.
knows that what's going to happen with it? It is scary.
Y- Absolutely. And I want to bring this to your attention too. I love LinkedIn posts sometimes, like sometimes they're just right on the money. One of them in particular talked about AI, that it was actually Sarah Connor in Terminator 2 that smashed apart like one of the computers that actually has the same name as one of the big AI servers right now. So I thought that was also interesting and an interesting choice. And I believe it's linked to Claude. So that's again a whole other conversation. And some of the things that the Claude owners have been saying has really disturbed me and concerned me greatly. So I've
Mm.
actually seen them speaking, like legitimately speaking about where they plan on taking Claude to. And it's like almost like it's going to take over humanity. That's concerning.
Yeah. I mean, people make jokes about things like that, but it's no joke. It
Yeah.
truly is
No,
a scary
no.
concept.
Yeah. Yeah. And at what
Mm,
point do we become iRobot? Like, these are the kinds of things, and hence, is it up to the therapist, the ethicist to say this, or is no one in IT actually thinking about where does this go? So we might be planning for the future and planning for productivity and financial gains and things like that. But at what point does a financial gain become humanity's pain?
good point. I think a big part of the problem is that not that many people understand what we do.
Mm,
They understand the idea of like gathering information and putting it down in a record and that sort of thing. But the art of what we do is
yeah.
something that probably is not in the ken of your average IT person. Or I
Yeah.
mean,
Yeah.
no
Yeah.
insult to IT people. Please don't shut me
No,
down
no.
because
Yeah.
the computer's probably listening to me now. But
Yes.
but no, I mean you no harm. We come in peace.
Yes. Back to Mork and
The
Mindy's
idea
Nanu, Nanu, Nanu.
But the idea that, what we do is largely misunderstood by, I think, a lot of people as well as what I mean, I just think most people just have no idea what goes into our training and
Yeah.
our work
Yeah.
and how we
Yeah.
develop our ideas.
Yeah. Absolutely. Um, I like where you're going with that, because then that takes me to some other place too, talking about ideas. So in my youth, I worked in the film and TV business and alongside creatives, and I became a professional creative. And so I've got a lot of IP, intellectual property, in the therapy field. So I've brought a lot of new things and what have you. And so there's that other side of it. And that concerns me greatly, because I used to, again, I've had many hats in this lifetime. I used to sign like contracting documents regarding copyright and IP protection for filmmakers and music licenses. And so because of all of that, I've got some interesting knowledge that AI doesn't have about how and why IP, intellectual property, is so important for humanity.
Hmm,
Because what
that's
makes
true.
an artist? Like a Picasso is not a Leonardo da Vinci, is not a, Descartes, or it's not a, you know, any of the other, greats that we could talk about. So, this is part of the issue I think we find ourselves in, is what makes us us. And why are we not, like a computer? And why do computers keep trying to be like us, but they never quite get it right?
Right. If you ever ask an AI to make a joke, it turns out very badly indeed. So, I mean, the subtleties of what we
Yeah,
do. I mean, you
yeah,
can grasp bits and pieces of it. And in fact, since we're talking about LinkedIn, some of the posts that I've been making, I've been seeing other people coming up with other things that are very similar, and which is great. I mean, if you have an idea and if you can get it out in there in the world, but some of it shows some telltale signs of being influenced by AI. So,
mm,
like, my ideas are going into that cloud, and then other people are picking bits and pieces out of that, and
yeah.
so, like, what happens to our work once it gets started getting disseminated?
Exactly. Well, that's also really interesting. I've been playing with that idea even with AI because of who who I was in a former life. So I've been talking to AI. Do I get to keep this intellectual property if we finish this? And do you actually own it? And what it actually spat out to me is, it remains mine because I came up with the idea first. So it's more like a secretary, and it suggests that. But at what point does, say, any of the other AI services then start saying, no, no, we're taking that back. That's ours. And I'm going to steal your stuff back. One of them will probably do that at some point.
It's subtle too. I mean, if you think of it as a secretary, I mean, suppose you like talk to your secretary about something that you're doing, and then your secretary just they finds it really interesting and goes on and tells somebody else, and then they
Yep.
tell somebody else, and and
Yep.
even though it remains yours, it still gets talked about, and therefore it
Yep.
gets disseminated.
Yep.
I'm getting nervous Maybe we should talk about something else. It's a terrifying thought in some ways. Well, you mentioned the family. Maybe we should talk about families.
Well, that's a whole other can of worms. Yes. Yeah, I guess, there's I see both positive and negative things happening within the family space because I work with individuals, couples, and families myself in my practice. So I work with a really interesting cutting edge intersectionality of work in my space because I've worked in so many different ways prior to being a therapist. In Australia, we don't have as much strict licensing where you have to do X to be a licensed marriage and family therapist, or you have to do Y to do
Mhm,
this. We have licensing, but we have more generalized licensing. And then you specialize from that. And so, because I've got some American counterparts, just the way that I've compared and contrasted how we do our training, it's quite vastly different. So we'll get really good generalist training and then we kind of build from there. So I've done a lot of building blocks in lots of different areas rather than, so I've been a bit of a jack of all trades rather than just go, right, I'm just a licensed marriage and family therapist.
mhm,
And so I kind of end up hearing bits and pieces of so many different people's stories, including my children's and hubby's and so I love listening to people's stories. I guess that's a big thing. And I think AI is somehow diluting that. If we go back to that topic, AI is somehow diluting that. And I even think on some level, because of all the computerization of things, it's impacting my children around how they interact with me and my husband. I think, no matter how much we try and, get them to communicate or, if, try and encourage that, the kids growing up at the moment, because my kids are teenagers, are very different to 20 and 30 years ago children. And I think that's something else I have some concerns about based on my clinical practice as well as being a mum, kind of on both sides, is how do we mentally and emotionally connect with this generation of children to the same degree that we might have connected to our parents? And it seems like there's a much more generational divide. And, is there a huge group, because I see it everywhere, of kids almost lost in the world somehow? Mm.
mm. I like that. I don't like that they're lost, but I like the way you put that. Yeah, I think you're right. I think the way that communication has changed, even amongst kids themselves, and especially in families. There were always communication divides, but who we communicate with has changed drastically. Now you can basically go online and have a best friend who's 3,000 miles away that you've never met. And, I
Yeah.
hear this all the time with kids. They're like, well, yeah, I don't really hang out with the kids in my school, but I go on Discord and I talk to this person and that person, the other, and they're like my best friends. So
Mm.
these are people you have no idea who they actually are, and you never get to really see them. You'll
Mm.
probably never meet them. But yet at the same time, the connection is different. And so what does that do with connection in the family?
Y-
Because again,
Yeah.
we didn't grow up that way. So it's
Mm.
like
Mm.
it's a totally different paradigm.
Yes. I think it's shifted from the old concept of the pen pal or, someone you might ring if they moved interstate and that kind of thing in the past. It's more like now something different again. It's using technology to do the same kind of thing. But then if we look at the online disinhibition effect, it then creates more disinhibited communication and communication styles. And it's almost like kids are drunk, if we want to go there,
Mhm.
because I can go down another spiritual rabbit hole. We end up being affected energetically as well by that, by being too connected over these kind of systems rather than to the person sitting next to us.
Yeah, I find that's true even with the difference in between online therapy and in-person therapy. I was just talking to somebody about that yesterday. The energy is different. The energy is more diffuse, and it's interesting too when you talk about how that gets diluted. Think, for instance, of somebody that you've never met that you have a lot of it's you call it like being drunk. It's kind of like that, but I'm sort of like putting all this together in my head as you're talking about it with thoughts that I've had.
Mm.
And it's almost it's a little more like hallucinatory to me. I
Yes.
mean, in a way,
Yes.
it's kind of like you're interacting with something that's not entirely real, and it enters a level of
Yeah.
unreality that seems so real.
Yep. Yes.
It's just absolutely
Yes.
fascinating and
It's
also
like a
terrifying.
space of
But
hyper realism is probably,
hmm,
what some people talk about in the online therapy space. Yeah, and there's just been a lot of, international writers about the online space that have written about it for a long time. And, there was the old ICQ chats and things like that that happened across the 90s and early noughties at the time. And I was one of those early 20 somethings using those kind of chat services. I actually met a number of people in those days. So it's not that dissimilar. However, it was more sparse and it wasn't the thing you did to game with your friends or to, it was more just here and there for a bit of fun rather than
mhm,
a thing that. So I think there's just different levels of engagement, and it's almost like the extent of the engagement is much more all pervasive than how it was before. And I think, at my children's school, they require devices across our state. Here they do. I know in different areas across America it's very different, but it's in Australia we've really seemed to adopt technology in a big way, but it means that then the kids have to use the technology whether the parents want that or not. And then that develops
mhm.
often bad habits.
Yeah, that's true. I used to teach at a university, and I'm kind of sometimes I feel like I miss that, and I would like to go back to that, but it's changed. Almost
Yeah.
all classes now have at least part of an online component. There's much more you're being lectured at rather than having a dialogue with students. And the assignments are things that you have to submit through email, and you don't get to like really hold a paper in your hand anymore. It's really kind of it's a big change. The world is evolving,
Yeah. Yeah.
but are humans
Yeah.
evolving along with it?
Yeah, that's the question.
And I mean, yeah, I'm often fascinated too by how other countries handle like licensure. Like you said, it's a different story in Australia.
Mm.
Here
Yeah.
in the USA, I'm licensed as a psychologist, but I also work with children. I work with families. I work with couples. I think we both
Yeah.
got bumped out. The last thing I can recall saying before we got so rudely interrupted by technology,
Yeah.
maybe you didn't like what we were talking about, was the differences in licensure requirements and how we can start out with one thing, but we can move on to other things. And where do you see yourself going in the future? I mean, what directions would you like to take? Learning wise,
Yeah.
practice wise?
Yeah. There's a lot of things that I've already got in place. So I've built a system, and I've built a system that's a bit of a big deal. So it's about 90 days or so, and we'll be launching first phase. And then after that, it'll probably be another 90 days. We'll do second phase. So yeah, so it's a big thing. Yeah, I've built an app, and it's going to be a global wellness app for all manner of different types of practitioners and what have you. So yeah.
Oh, that's great. Can you
Mm.
tell us more about it, or are we going to have to wait and see? It's a
Mm.
chance to do a tease.
Yeah, I guess I'll say a couple of things, but some things I can't speak to just yet. But it will help people to be able to find better practitioners.
Wow, that's good.
Yeah.
That's good.
Yeah.
Finding a perfect fit is
Yes.
really difficult, and it's something that you really have to fish
Yes.
around a bit for. It's a bit like dating in a way. But, anything that helps get you to a person who has the specialties and the
Yep.
expertise or the knowledge or even the
Yeah.
perspective that works with
Yes.
you would be most welcome.
Yes. So put it another way. It's got privacy by design embedded. It's got all the things we were speaking about before I've considered. It's why I'm quite vocal about these things because I think I'm a very deep thinker because of, I studied existential philosophy in my master's as well. And I became an existential psychotherapist at the end of that. So so I think deeply about the state of the world and humanity and our existence and all that. And so I try to be the change I'd like to see in the world. And so it's like I put my big girl panties on and my big girl boots on and go, okay, no one else is doing this. I've got to do it. Yeah.
And that's the way it works out best. I finally read a book about all the things I've been putting together in bits and pieces over the years. So Frankenstein's monster, like it was sewn together, and it's going to be out there pretty soon. I'm
Mm,
also from that taking a workbook, and I want to do retreats. There are things that I want to do. And I
mm,
think, we have to keep learning and growing and using our
yeah.
expertise to create new things and to
Yes.
forge
Yes.
ahead.
Absolutely, absolutely. What I can tell you that it's almost about to hit the market though, is I've got these weirdly enough, because of just how quickly AI can do things and how quickly we can put together things now. Because I've been working in the field about 24 years and I'm the daughter of two different mental health professionals as well. So I've been around this kind of field for most of my life. And so I kind of have seen a lot and been around the block a bit more than people would think. And so because of that, I've got a lot of knowledge about just mental health stuff in general. So I've put together a card deck for clinicians and the general public about psychology, about spiritual practice, because I've tried, like I majored in my master's in mindfulness and existential practice, and then I also have gone off and done retreats previously as well. In because I've spent some time over the years with women's groups, and so I've kind of put all of that knowledge into a card deck. Yeah, so so that's what I've put together recently. Yeah,
Oh, that's fascinating too.
mm. Yeah. I like to bring I like to bring practical things to the world, I guess you could say.
Yeah, yeah, no, that's important, and thank you for sharing that. I would like looking forward to seeing that myself.
Mm,
Thank you for joining us, and thank
thank
you
you.
for holding space for even our technical difficulties. But we look forward to hearing more from you, and maybe
Sure.
you can rejoin us again once all this comes out and tell us more
Yeah.
about how it's going over.
Yes, thank you. I'd love to chat again. This has been great. Thank you for
It
having
is.
me. Yeah.
Thank you for coming. And thank you all for holding space for us. If you like this sort of content, like, subscribe, leave comments. I do get back to answering those as quickly as I can in between shooting one thing or another or writing one thing or another, but it happens. And if you have any suggestions for other things that you'd like to see, or if you have any guests that you'd like to suggest, please feel free to volunteer that. And thank you so much, Renee. It's been a
Thank
pleasure
you.
meeting you.